New videos every day.
Hi, this is Dr. Vince Belanzi. I want to talk to you tonight about orthomolecular psychiatry. Yeah, it's a big word, I know, so I'm going to explain it. Really, orthomolecular is just a word describing that the molecule is the same. So if we're talking about orthomolecular substances, we're talking about things that are like you. Now, when we talk about psychiatry, there's a whole science that's developed behind the idea that if we label emotions, if we label conditions, that we can then treat them based on those labels. The truth is, I like to call it nothing but a chemical imbalance. Now, let me explain that. When I talk about a chemical imbalance, there's a couple different ways to approach that. Now, chemicals can be imbalanced, and that's the reason for your emotional problems, because the chemicals are imbalanced. And we can look for balancing those things naturally, or we can balance them with drugs and other chemicals. I prefer to use what orthomolecular psychiatrists use, and that's natural substances for the most part. So we can balance that chemistry. We can bring the neurotransmitters and the hormones back into balance by using natural substances like protein, amino acids, like vitamins, minerals, things that your body needs, things that your body's looking for, the nutrients that you're supposed to get out of your food. That's the better approach. If we can balance the chemistry with things that are natural, then the body can decide how to dose you. In other words, rather than my giving you a bottle of Prozac or prescribing some other chemical for you to correct the chemical imbalance, why not allow the body to bring itself into balance? If we remove enough interference, if we can give the body the things that it needs, then there will be a balance of the chemistry. If there's a balance of the chemistry, then even psychiatrists will admit that we have solved the problem in a sense, because the emotions are controlled by chemistry. So it's not a matter that you have a deficiency or that you were born with a need for some of these pharmaceutical chemicals. What we're trying to do from either direction is to create a balance. So if I can get your chemicals, your hormones, your neurotransmitters in certain ratios and balanced, you'll have control over your emotions, and we won't have to give you a label of some kind of an emotional disturbance. So we want to take that approach, especially in the realm of this new science called orthomolecular psychiatry. We have psychiatrists, medical doctors, that are approaching emotional problems with natural substances, vitamin B, amino acids, things that the body needs anyway. If you give the body what it needs so that it can make the correct chemical, then the balance is created from within, and you have a solution to the emotional disturbance. That's really what we want to talk about. So literally, we can now measure the levels of especially excretory products, meaning that we can measure your neurotransmitters by doing a urine test. We can determine what's imbalanced. Is it serotonin? Is it dopamine? Is it norepinephrine? Is it epinephrine? We can look at the whole picture because things operate in a balance. You have one neurotransmitter balancing another one. The same with hormones. One works with or against the other, so you create a balance. If I can do this with your chemistry, you'll not only think better, but your body will operate better. That's what functional medicine is. But orthomolecular psychiatry just has to do with molecules that are like your body, that it will recognize, that won't cause all the side effects, and that will give you the same balance that you can get through pharmacology. So a little bit better approach if you want to be able to avoid those side effects. What we want to do is create a functional body. We want to have control of our emotions. We all do. It's not just that you have a label and therefore you have to be balanced. Everybody needs balance. If you're going to have an even keel, if you're going to be able to approach problems and solve them, if you're going to be able to focus, if you're going to be able to get along with others, you need chemical balance. You need your emotions to be under control. And the way that you can control them is truly biochemical. So if we can take an approach that uses nutrients, that allows the body to create balance, that looks at the whole picture and all of the ratios and how things work together, then we can create a body that's functional, a mind that's functional, and we don't have any problems that we need to label. So again, when we talk about orthomolecular psychiatry, we talk about using substances that the body recognizes, that don't cause any side effects, and we give the body a chance to regulate itself. That's really a much better approach than to use all these pharmaceutical drugs. Not that pharmaceutical drugs don't have their use. There are times when we need to bring things under control, and it needs to be done aggressively. But we don't always need aggressive treatment. In fact, most of the time, we don't. So again, orthomolecular psychiatry, using natural substances to balance your neurotransmitters, a much better approach. Now, how do you think you can do this yourself? Simply by eating better. If you're getting those nutrients in your diet, you're going to have a better operating chemistry. There's a number of studies that have been done. There are a number of people that have helped themselves just by improving diet and exercising. So an orthomolecular psychiatrist just takes it a little bit further. Maybe we need what are called nutraceuticals. Just means higher dosages of isolated nutrients. Again, if you use nutrition, if you take care of yourself, you're going to be creating your own imbalances or your own balances and correcting the imbalances. So orthomolecular psychiatry has to do with looking at the whole picture. It's a way of looking at the body holistically. It's a way of looking at those chemical imbalances and correcting them without using pharmacology. In a sense, you're using the science behind pharmacology. You're not using a drug that was necessary to use to go at with such a strong action. So you can take care of yourself. You can do things for yourself. And if you need help, go to an orthomolecular psychiatrist. Go to a clinical nutritionist. Go to someone who can help you create the balance without causing more imbalance. If I simply give you one particular neurotransmitter and it's pharmacologically manufactured, it isn't even close to the one that you have. Or if I simply use pharmacology to change balances in your body, to either stop the reuptake of something so that you build up more, or to press a biochemical pathway to produce more, I'm forcing the body into creating a ratio I think should be there. Why not allow the body to create the balance that it knows it needs and take care of it that way? So again, orthomolecular psychiatry, just a big word. All it really comes down to is using natural means, using things that the body recognizes, and allowing the body to come into balance. If your chemicals are balanced, so are you. This is Dr. Vince Belanzi. Thanks for listening again. If you need to contact me, you can go to my website, www.bewellrx.com, and I'll be happy to answer any questions. If you need help and you're not in the area of Austin, Texas, look up a clinical nutritionist. Look up somebody who can help you create this balance naturally. Good evening.